I'm gonna walk in, provide privacy, hand hygiene. Hey, my name is Caitlin and I'll be taking care of you today. Can you tell me your name and date of birth?
Christy Mayo, 3/14/70.
Okay. Do you have any allergies that I need to know about?
Naproxen.
Naproxen, okay. Well, the doctor has ordered for a head to toe assessment. Do you know what that is?
I do.
Okay. So, I will start. Are you by asking, are you in any pain?
No, I'm not.
No pain, okay. Can you tell me where you're at?
The doctor's office.
Okay, why are you here?
Just for a regular checkup.
Okay, so that's assessing her neurological. So I'm going to start with your head. So I'm inspecting her head. It's normocephalic. There's no lumps, bumps, contusions, lesions, anything in her head. Okay, and then have you had any headaches or anything recently?
Not recently.
Not recently, okay. And then looking at her eyes are symmetrical, and they are in the correct place. I am going to nail check for Perla. So I am, so right now her pupils are equal and round. And now we are going to check for reactive to light and accommodation. Okay? Okay? And this is direct because I'm looking at this pupil. Okay? This is consensual because I was looking at this pupil and both of them constricted. Okay, now I'm going to do it on this side. Okay? All right. So now I'm going to hold this and I want you to look at my pen light, and then look above me at the wall, and then look back at my pen light. Okay? Okay? And that assessed for accommodation. Her eyes, her pupils constricted when she was looking at the pen light, dilated when she looked off, and constricted again when she looked back at the pen light. Okay? So she has Perla. Okay? So now I'm going to, have you had any issues with your vision? Been hard, any blurry vision, anything like that?
No.
No? Okay. So go into her nose. Her nose is symmetrical. There's no displacement or anything. Gonna look up your nose. Okay. Looking at her nares, everything seems to be good there. Have you had any trouble smelling or loss of smell or anything like that? Okay. Well, looking at her mouth, if you will open your mouth for me. Okay, the mucous membranes, they look moist and pink. Everything looks fine there. No loose teeth, no missing teeth. Have you had any pain in your mouth, any bleeding gums, anything of that sort?
No.
No? Okay. Now looking at her ears are symmetrical. They're in the right position. They're at the right height that they should be, so everything's good there. Now, if you will, I'm going to ask you to stand up, and we're going to perform the whisper test, okay?
Okay.
Okay, and what I want you to do is repeat what you hear me whisper on each side, okay?
Okay.
Blue.
Blue.
Okay.
Purple.
All right. So she, you can take a seat. She passed the whisper test, so everything is good there. And again, I forgot to observe her grooming. She's dressed appropriately for the occasion. She seems to have good hygiene and that she takes care of herself, so that's good. Okay, now we are going to move down and look at your neck. So if you can, I want you to, I'm going to observe her throat and her neck. Her trachea is midline. There's no deviation of her trachea. Can you swallow for me? Okay, she passed the swallow test. Have you had any sore throat or any pain in your throat recently? No?
No.
Okay. All right, if you will, I'm going to get you to slide down about 45 degrees. All right, and look that way for me. All the way. Okay, I'm observing for jugular vein distension. Nothing's present there. Okay. Everything's good there. All right, and while we're here, I'm gonna go ahead and talk about where her pulses are located. So right here where I was observing is her carotid pulse. And then you have her axillary pulse. And then you have her brachial pulse. It's right in here at the crease of her elbow. Then you have her radial pulse. Her femoral pulse is near the groin. Then she has the popliteal pulse is behind the knee. And then if you come behind the ankle bone is her posterior tibial pulse. And then on the top of her foot is her dorsalis pedis pulse. Okay? All right, so coming back up here, I'm observing the skin. The temperature's good. There's no bumps, bruises, unusual markings on the skin, so that's good. Okay, I'm gonna ask you, have you had any issues with your skin itching, your skin burning, anything like that?
No, ma'am.
Okay, so now I'm going to kind of move into my respiratory part of it. So, have you had any shortness of breath or anything recently? No shortness of breath. Okay, good. Do you know have you had a cough?
Maybe just a little one.
Okay.
Nothing major.
Have you had any sputum? Anything come up? Okay, so it's been kind of like a dry cough?
Dry cough.
Okay. All right. Do you know what an incentive spirometer is?
I do.
You do? Okay, you know how to use it?
I've used them before.
Okay, so I want you to hold this for me. This is for the sake of the video. This is my incentive spirometer. So I want you to put your mouth on it, hold it up to your mouth, and you're gonna breathe in and see how far up the incentive spirometer you can go. So what this does is it helps expand your lungs and prevent any pneumonia if like usually after surgery or anything like that, okay? And then another good technique for that is to turn, cough, and deep breathe. And when you do that, it helps to clear your lungs and also to prevent pneumonia. Okay, so I'm gonna listen to some lung sounds now. And for the sake of the video, I'm gonna do it through the shirt. But in a real setting, you would do it skin, the stethoscope to, the diaphragm of the stethoscope to the skin. Okay, so I'm gonna listen to 4 anteriorly, 2 laterally, and 4 posteriorly. Okay. Okay, could you lift your arm up some for me? Okay, lift this side up for me. All right, could you lean forward for me so I can check the back? And I forgot to mention that every time she feels the stethoscope on her back or on her body, she would take a deep breath in. Okay. Okay. And there were no adventitious breath sounds. All lobes sounded clear, so we're good on that. Now we're going to move to listening to your heart sounds. Have you had any like chest pain, any tightness of the chest, anything of that sort?
No.
No? Okay. Well, listening to her heart sounds, you're going to start over here with aortic, and that's in the second right intercostal space. And then you're going to move over to the second left intercostal space, and that is pulmonic. And then the third intercostal space on the left is her Erb's point. And then you have the fourth intercostal space on the left is her tricuspid. And then the fifth intercostal space on the left is her apical, which is the apex of the heart. It's mid-clavicular in the fifth intercostal space. Okay, so that's just what I'll be listening for.
Gracious.
Okay, and when you are listening to the apical, you will listen to it for a full minute. And if there are any low-pitched sounds, you would flip it over and listen using the bell of the stethoscope. Okay, I'm now going to feel for edema or assess her for any edema, and I'm going to start at the base. I'm going to start at the most distal part of the body, and I'm just going to move up, feeling for any edema bilaterally. Okay. Everything seems fine there. Okay. Okay. Everything's good there, no edema present. And I forgot to mention that when you are assessing the pulses, you would also do that bilaterally as well. Okay. Let me assess for capillary refill. So I would squeeze the fingertip, and color came back with under less than 2 seconds, which means there's good circulation going through. Okay, and up here I also forgot to assess her skin turgor. So I pinched a piece of skin and it recoiled immediately, which means she is not dehydrated, so that's good. So now we're going to move to the abdominal region. So I'm going to ask you to lay back just a little, and ideally in the hospital when you're doing an assessment, you would have the patient laying supine so you can assess the abdomen, and you would do it under the shirt as well. So have you had any issues using the bathroom, any constipation, diarrhea, anything like that?
A little bit of constipation.
A little bit of constipation, okay. Can you tell me when your last bowel movement was?
Day before yesterday.
Okay. So I am going to inspect the skin, look for any abdominal distension, any unusual markings, any unusual moles that may be present. I'm going to observe the umbilicus, making sure that everything is good there. And then I'm going to auscultate, listening from the right lower to the right upper, left lower quadrants of her abdomen. And I would listen for a full minute in each quadrant. Okay, there's no unusual sounds there. And then I would assess for any bruits. So I'm going to flip it over and use the bell of my stethoscope. Listening at the bottom of the xiphoid process. Okay. There's no unusual sounds there. So that is good. Okay. And you said you haven't had any pain or anything in that, in your abdomen, okay? Have you been able to pass gas?
I have.
You have? Okay. That is good. Do you have any tenderness or any pain in any area of the abdomen? Okay. So if she were to say that she had pain in the abdomen, you would palpate that quadrant last. But since she has none, we would do the same order as we did with auscultation. So you're going to lightly palpate, observing for any tenderness, any grimacing of the face, anything of that sort. And then move up, and then over, and then down. Okay? All right, so we've done the abdominal assessment. Now we're going to move to musculoskeletal.